Good morning. Try and get this on so you can hear me. I'm going to talk a little bit about our grant, and as Dr. Reese said, we are establishing geriatric fellowships across the state of Michigan. This grant came from the Human Resources and Services Administration in 2011 and is for about $800,000. This is a joint effort between Family and Community Medicine and the Division of Internal Medicine. There are a lot of objectives to this grant. One is to actually form a statewide Department of Family Medicine and Internal Medicine for geriatrics. The additional things that we said we would do was add curriculum to the undergraduate courses at Michigan State University, as well as establishing fellowships. We did talk about doing a part-time fellowship, but the reason that we're looking at doing this is in this country, there are about 35,000 less geriatricians than there is needed at the moment, and that is getting more acute in the fact that we have an aging population of baby boomers who are going to hit age 65. Some already have. The difference between this program and some of the other programs is the concept of optimal aging, which is at the center of this. This is probably the biggest difference that we have. You can read this yourself, but when I looked at this, I felt that this was very osteopathic in the way that it was written. And so it is what I used when I wrote my grant to actually put this at the center of things. We are trying to deal here with the body, mind, and spirit. Often what you see is that we as physicians deal only with the body. We don't necessarily pay much attention to what our patients do as far as their mind and their spirit. And I have seen over a period of time that my geriatric patients sometimes feel lost once they are no longer employed or once their children have grown, and somehow they get stuck in their journey in life. And life is a journey. We all are in it. We start out as babies and we live through whatever years we have. But I think as osteopathic physicians, the onus is on us to try and make all of our patients, or help all of our patients in this journey with not just their body, but their mind and their spirit. And so this is what's different about this grant program. In terms of the people that are involved with this, you will hear from two of them as far as the directors of the division. One is Frank Kumara. He is a geriatrician with the Department of Family and Community Medicine. And Annette Karen, who will be speaking a little bit later also, who is our associate director. We have various oversight committees which are needed for the grants. We have recruited some new faculty, and our current partners at this point are our home program at Sparrow, which is a duly certified AOA and ACGME program. There is also a geriatric fellowship at Botsford, of which Annette Karen is the director. Dr. Komara is the director of the Sparrow program. We have additional spots at Metropolitan, Lakeland, and Detroit Wayne County Health Authority Graduate Medical Education Consortium. This is a program of 85 residency spots, 2 of which are geriatric spots. In terms of how we are going about doing our evidence-based steps to achieve optimal aging, we want to look at quality of life issues and decision-making. We're looking at cultural differences, medical disparities, health literacy, but our big piece that's different are our mind-spirit considerations. This deals with complementary and alternative medicine, also with spirituality and some of the other concepts, and also sexuality. When I was about your age, I was kind of stupid. And, I thought life sort of ended at 35 or 40. And boy, was I wrong. My patients taught me differently. Actually, one of my current patients is a 65-year-old man who said that, yes, he doesn't think about sex quite as much as he used to. He used to be about 100 times an hour. Now he's down to about 85. And at age 65, he's grateful that his wife and his mistress still both like sex. So it doesn't end, folks, and that's part of your responsibility, too, is to actually keep your patients current with what's going on in their life. When I was in the hospitals and training, it was, for me, there were a lot of people that were there dying, and they weren't necessarily dying in the best kinds of ways. Many of them were being kept alive on different drugs and machines and so forth, and they have no quality of life. Now we make a difference for our patients in terms of quality of life because we can counsel them and let them make an active choice of how much longer they want to keep going with this whole thing. In terms of, we have a patient-centered medical home for our senior citizens with group visits, and we are working effectively in a multidisciplinary team. One of the things about being a physician is it sometimes gets lonely, and nobody necessarily teaches us how to interact with the other health professionals that are out there that can be of great assistance to us in going forward in this situation. We look at the community resources that already exist. We're not interested in trying to create a new wheel. So we're working with other agencies such as the MyPath people for our wellness groups. We also have gone forward with the Rural Health Association and their hospital system. We've talked with the state of Michigan, who is very interested in what we're doing. In terms of the modules that are completed at this point or under construction, you can actually see those. Currently, we have 13 approved positions. They're not all funded. And so part of why I'm here today is to try and see if some of you might have an interest in a geriatric fellowship. It's a one-year program, and at this point, we have many openings. We currently have 2 positions that are filled, and I think you'll at least get a chance to meet one of our fellows later today. We're adding to the curriculum in the way that's noted here. We are looking at a part-time geriatric fellowship for kind of a work-study program. We have not put this into place yet, but part of, as I showed you, our partners include State of Michigan, Michigan Primary Care Consortium, Rural Health, and the Michigan Osteopathic Association. In terms of, we're actually going into our 3rd grant year, and our recruitment plan is to, and I will announce it here today, we are going to have a competition for all residency programs in the STS. And what we're looking at is an event in the spring for presentation of papers and posters, and there are some cash awards that will be involved. You're hearing this first. All the details aren't on paper yet. You should be getting those within a week or so. But at this point, if you want to spend some time in the project that you need to do academically for your residency, you might as well enter our competition. Of course, you have to do something in relationship to geriatrics.